You're listening to Health Professional Radio. My name is Wayne Buckler. Today, I'm chatting with Dr. Luke Arundel from Optometry Australia, and Luke has joined me on the phone now. Good day to you, Luke.
G'day, Wayne. Thanks for having me on the show.
My pleasure. Now, as you know, Luke, our audience is mainly hospital-based clinicians and administrators, and you're with Optometry Australia. I made the mistake once of thinking that everyone in health knew everything there was to know about health, but I sadly discovered that that's not the case. So tell us about Optometry Australia, your size and footprint to start with, please.
Yeah, sure. Optometry Australia, we're a reasonable size. We represent over 90% of the Australian optometrists. There's about 4,500 of us nationwide. With respect to geographic footprint, we're a not-for-profit organisation, and we're composed of 6 state bodies. So we have a national branch based here in Victoria, where I am, and of course state-based branches scattered throughout Australia.
I see. So you're a peak body in optometry then, I guess?
Yeah, that's right. We're certainly perhaps the influential voice for optometry. We do a lot of representation, a lot of advocacy work. We have a policy team based in Canberra, we provide a range of services for members and also for the public.
Now, just in my ignorance here, can you answer for me what the scope of optometry is? Does this include ophthalmologists? Like, where are the boundaries around this? Yeah,
sure. Look, that's a really interesting question, Wayne. Optometry is a rapidly evolving profession. And, it's been a profession I've been a member of for 17 years, and even within that period, things have changed drastically or radically. Throughout that period, optometry had only just gotten diagnostic drugs back then, and over the last 10 years, optometry has changed in the scope of practice, in that now we are, a large proportion of our members are now therapeutically qualified. All 5 universities around the country, all of their graduates now come out with a therapeutic qualification. And for any of the older optometrists that graduated under the previous schemes, they're able to take an accepted course back at university, typically a year, placements, et cetera, and at the conclusion of that additional course, they also are able to prescribe therapeutic medication. So this has really changed the scope of things for us from simply prescribing glasses now to becoming more and more involved in primary healthcare.
That is a significant change, and one that I hadn't realised had taken place. So the scope then of the profession as it stands now, do you see it as being a primary healthcare provider?
Absolutely. Yeah, and look, something that's really critical, Wayne, is that 80% of vision impairment is preventable if it's detected and treated early enough. Optometrists are the main providers of primary eye health and vision care in Australia. No ifs and buts about it. We work very closely with ophthalmology. They tend obviously to help us with the more advanced cases, surgical options. We now co-manage glaucoma with ophthalmology, which is a really fantastic benefit for the Australian public, particularly out in country areas where access to ophthalmology has become more and more difficult. This is going to provide a significant benefit for the Australian public.
Now, formerly, Optometry Australia was the Optometrists Association of Australia.
That's right, yeah.
With that name change coming through, has the presence of the organisation, the raison d'etre of the organisation changed as well?
Yeah, well, I did actually look it up prior to the interview. The association was first formed in 1918, and it carried on under the name Optometrist Association Australia to mid-2014. when they had a significant period of reevaluation, a bit of a shake-up, re-examining core focus, and really streamlining what it was that we wanted to do. And, they've come out the other side a very tight ship, with clear goals. And these days, Optometry Australia, its primary goal is to actively strengthen, protect and promote profession of optometry on behalf of all optometrists. So, realigning some of the core focus and strategic goals has been an important part of that name change. It's certainly not face value only. It's been a deeper re-examination, I think, of the whole organisation and exactly its purpose and point, in providing services to members, optometry members, and of course members of the public as well.
You're listening to Health Professional Radio. My name is Wayne Buckler, and my guest this morning is Dr. Luke Arundel, the resident optometrist of Optometry Australia. We've been chatting about the organisation and its history. Luke, why should optometrists join you? Or first of all, do optometrists join you, or do they join a state association? And then my second part of the question is, what are the benefits of membership?
Essentially, optometrists join their state association, and we come under the umbrella of the national organisation. In respect to why would they do that, pretty straightforward. We provide a huge range of services. Things that we do first and foremost, we provide a very comprehensive indemnity insurance policy for members, which is currently the best in the profession. We do things like, or members also receive confidential and impartial clinical and professional advice, and they have access to a suite of resources which are essentially designed just to make the day-to-day practice of optometry more efficient. We provide vision standards, guidelines, and also provide marketing, financial, and HR advice. So again, things designed to help the optometrist in their day-to-day running of their practice, or day-to-day practice of the profession. A large part of what we do, or what Optometry Australia does, is organise state division conferences and professional development programs. And these are designed for optometrists by optometrists, as well as obviously providing quality education. These conferences also run careers expos and foster networking opportunities. So, very important further on down the track, to be thinking about these career opportunities. And we run these career expos for students and for grad students, so connecting them with members so that it's mutually beneficial, of course. Alongside the core member focus, as I mentioned, we provide information and assistance directly to members of the public. And we've also got a policy team, and it's this policy team that's meeting regularly with health ministers, advisory boards and committees, and it advocates on behalf of members and also on behalf of the growing eye health needs of patients. And that's a really important part of what Optometry Australia does, and something that I certainly wasn't aware of exactly how much work is going on in this sphere prior to joining the organisation.
That's a really comprehensive suite of services and member benefits that you've just named there. Luke, if there was one misconception, be it amongst patients or clinicians or even members of yours, that drives you nuts and keeps you awake at night, what would that be?
Well, perhaps, one of the biggest issues that's keeping all of us here at Optometry Australia awake at night, has been the recent changes to Medicare. And I guess a lot of your listeners are probably aware of the squeeze on the health fund dollar. They may not know that, on the January the 1st this year, Medicare rebates to optometry were cut by 5%. We've also had indexation frozen until 2018. So what I think is important to get across is, unlike some of the changes that were proposed to the GP consultations, there were no exemptions for pension or health card holders, children, or those in aged care. So, with continually reducing rebates, many of our members, many optometrists, are finding it simply unviable to continue bulk billing. So what's keeping me up at night, and what's certainly keeping the policy team up, is, we've got this significant concern that for those on low incomes who can't afford an out-of-pocket expense, that this is going to lock them out of accessing healthcare. I mentioned before, that a lot of, 80% of visual impairment is preventable, and the significant role that optometrists have in preventing, detecting, managing eye disease and vision problems. And, excuse the pun, this is a very short-sighted change from government. The optometrist's role in preventing and reducing the significant economic cost of what is essentially avoidable vision loss is going to become more and more important as our population ages. There's numerous studies out there talking about, the total economic cost of vision loss in Australia, and numbers of $16.5 billion per year are floated around. That's what it's actually costing the government. So, we feel that these changes that have been introduced recently, may help short term save a few dollars for the government, but no one's really thinking about the big picture. And it can be very difficult to persuade governments of the value of preventative eye care when they're focusing solely on the short term.
That's a good reason to stay awake worrying at night, I suspect. There are puns aplenty here with big pictures and not having clear vision of it, isn't it? But we'll leave all those aside for the moment. It's been a pleasure having you have a conversation with me today, Luke. I do appreciate your time. You've been listening to Health Professional Radio. A transcript of this interview and an audio archive file of it are available on our website. And if you'd like more information about Optometry Australia, you can contact them via their website, www.optometry.org.au.
Thanks very much.